Now let's talk about the treatment of schizophrenia. Now we know schizophrenia is a psychotic illness. So which drugs we use? Yes, we talk about antipsychotic. Again, a very important topic. So many times you will see questions being asked from the treatment. Now we know that we have first generation or the typical antipsychotics, and we have atypical or the second generation antipsychotics. Now we have learned that there is increase of dopamine in the brain of the patient with schizophrenia. So what is the mechanism of first generation? Remember, they are D2 antagonist. We have also learned even serotonin is also increased. So remember that second generation are not just D2 but also 5-HT2A antagonist. So remember, both are 5-HT2 and D2. And how to remember which 5-HT2? Remember A for atypical. So please remember, second generation are D2 and 5-HT2A antagonist. Let's also discuss some more points. So when we talk about which symptoms usually are targeted, the first generation antipsychotic usually are effective for positive symptoms, while the second generation is effective both for positive and negative symptoms. Again, we can correlate with the etiology because we know that increase in serotonin causes both positive and negative symptoms. So second generation also are 5-HT2A antagonist. Now let's talk about some important side effects. First, we'll talk about EPS. Now we know EPS occurs, extrapyramidal symptoms, it occurs because of D2 antagonism. So remember, usually EPS is more with the first generation and less with second generation. Also now let's talk about metabolic syndrome. So patient receiving antipsychotics may complain of weight gain, may complain of hypertension, diabetes, or there is dyslipidemia, or may develop cardiovascular disease because of these antipsychotics. Now remember, the metabolic syndrome or metabolic side effects occurs because of 5-HT2 antagonism. In fact, which serotonin receptor is affected here? Remember, it is metabolic syndrome. So remember, because of 5-HT2C antagonism. Again, how to remember? You can see that which drugs are having antagonism at serotonin. So it is the second generation. So remember, usually we see that these metabolic syndrome is more with the second generation as compared to the first generation. But of course, there are some exceptions which we will discuss.